This is Rob. He is 72 years old and was diagnosed with Parkinson's disease at 65, the average age of diagnosis. Parkinson's disease, or PD, involves the death of neurons in the region of the brain that controls movement, resulting in a shortage of the neurotransmitter dopamine. This reduction leads to patients losing motor control. This is often a telltale characteristic of PD, with tremor, bradykinesia, rigidity, and disturbances of balance and posture being the most prominent. Along with these motor symptoms, Rob also experiences non-motor symptoms such as psychosis, depression, and compulsive behaviors. Although these symptoms are unlikely to manifest in all patients, Rob is feeling overwhelmed. Because of the disruptive nature of his symptoms, he goes to the doctor to discuss his treatment options.
This is too much for me, Doc. Last night I experienced these delusions. I was so stressed. I read that hallucinations are the biggest factor for nursing home placement, which only made me more stressed.
You may have Parkinson's disease psychosis, Rob. I am hearing these psychotic symptoms are disrupting your life. In terms of symptom management, I'll run you through the options available.
Treating Parkinson's disease psychosis, or PDP, is a tricky one, as it consists of lowering the dose of anti-Parkinsonian agents or prescribing an antipsychotic agent. When antipsychotics are prescribed, motor symptoms such as tremor and muscle impairment are significantly worsened through the blocking of dopamine receptors. Two second-generation antipsychotics are commonly used by clinicians, quetiapine and clozapine. They alleviate symptoms by inhibiting dopamine D2 receptors and promoting opposite effects to agonists on serotonin type 2A receptors. Clozapine's use is limited due to risk of neutropenia, requiring patients to have weekly blood tests. Whilst quetiapine's adverse effects include hypertension and sedation, quetiapine is preferred as it maintains a superior side effects profile compared to clozapine.
I've just had a look at my database. There is a new drug called Pimavanserin approved for the management of PDP. Give me a few days to see if it's suitable for you.
Pimavanserin was approved for use in the USA by the FDA in 2016. It has a unique mechanism of action that inhibits serotonin receptors, specifically 5-HT2A and 5-HT2C. This is imperative because PD psychosis occurs when 5-HT serotonin receptors are continuously stimulated. Due to its effects on serotonin receptors, it has been classified as an inverse agonist. An inverse agonist prompts a response that is opposite to what usually occurs during activation of receptors. Likewise, pimavanserin lacks affinity for dopamine receptors, thus correcting the imbalance of serotonin and dopamine in the brain. Rectifying the imbalance allows for PD psychosis to be treated without any major side effects, such as worsening motor symptoms associated with previous antipsychotics.
In theory, the mechanism checks out. Let's see what the drug trials say.
The FDA's drug approval process is broken up into 3 phases. Phase 1 proves drug safety, Phase 2 tests if the drug works, and Phase 3 confirms findings in larger groups. Pimavanserin passed Phase 1, only causing slight back pain at low doses, and headache and nausea for some at extremely high doses. Phase 2 assessed the drug's effect on psychotic and motor symptoms in psychosis patients. Sensory hallucinations and grandiose delusions were not significantly reduced, while persecutory delusions improved. Overall, psychosis severity was reduced, with no worsening of motor symptoms. However, the trial prioritized safety and motor complications over drug efficacy, restricting understanding of its clinical benefits in treating PDP. Although previous trials proved pimavanserin for PDP to be safe, 2 Phase 3 trials assessing efficacy were not published in full, providing little evidence on its clinical benefits. A Phase 3 randomized, double-blind, placebo-controlled trial assessed pimavanserin's efficacy and found a statistically significant reduction in psychotic symptoms. Combined with confirmation of no worsening of motor symptoms, this study provided sufficient basis for pimavanserin's FDA approval for PDP. Its clinical use is being evaluated in ongoing open-label extension trials.
If this drug does work, what are the social and clinical impacts?
Studies have found a range of symptoms, such as motor and neuropsychiatric symptoms contributed to institutionalization, with hallucinations being the strongest predictor. Furthermore, a 100% mortality rate was found for nursing home patients, opposed to 32% for community dwellers. Another study found 26% of PD emergency ward admissions were due to psychosis, and the duration of admission was 4 days longer than in controls. On top of this social stress, caregivers of PDP patients reported increased physical fatigue, poor relationships with family members, and deterioration in their health and social lives. These statistics show that PDP contributes to disease burden. If a drug was to alleviate this, it would have a profound social impact. Preclinical data has shown favorable pharmacokinetic and side effect profiles, but further analysis of clinical impacts will be revealed in current extension trials.
In summary, pimavanserin has proven to be safe and may be able to alleviate your psychosis symptoms, Rob.